assessing the thorax and lungs, heart and central vessels, and the peripheral vascular system. So first is assessing the thorax and lungs, which is a thorough examination of the respiratory system. The thorax comprises of the lungs, rib cages, cartilage, and intercostal muscles, wherein all the four assessment examination techniques will be used. The nursing skills also recognize and identifies normal and abnormal breath sounds, a crucial component of the lung assessment. So, the first thing we do is to inquire the client if he or she has any of the following: family history of illness including cancer, allergies, tuberculosis, lifestyle habits such as smoking and occupational hazards, any medications taken, and also current problems such as swelling, cough, wheezing, and pain. So, before doing the procedure, we need to explain the client what will be going in this procedure and explain that the client needs to expose the posterior or the upper portion. So first, we will ask the client to flex her arm like this. And then, we will proceed to determining the ratio and the size of the anterior, and same procedure will be performed in the posterior. And the same also to the other side. After doing it, there should be no signs of hyperinflation, viral chest, or any configuration. Now, we will going to ask the client to remove the upper portion of the upper clothing to expose the upper portion of the body, and position yourself to the rear view or the sides of the client. Instruct the client to stand and observe for the spinal alignment. So ma'am, can you please stand up? So now, we will going to observe the spinal alignment. We will also perform a straight way ahead by touching the head of the client, the spinal cord, and note for any curvature, scoliosis, and any forms of kyphosis or any forms of lordosis. We would also observe of the unevenness of the shoulder from side to side. Now, we will be inspecting for the spinal deviation on the substrate thorax. Instruct the client to bend forward and the hands should be hung freely. Position yourself to the back or behind of the client. So ma'am, can you please bend forward and hang your hand freely. Note for the unevenness of the left and the right curvature and an alignment or misalignment of the spine, and determine if the client has scoliosis. Also, observe the skin integrity of the client if the client has open lesions and open ones, or ulceration and ulceration. We would also determine the temperature, also the skin types, if it is moist or dry, and that is assessment for the posterior aspect. Okay ma'am, thank you. And now, we will be performing palpation, percussing, and auscultating the posterior aspect of the client. So, the first thing we do is to palpate for any tenderness, swelling, bulbs into the posterior aspect of the client. start with the apex, move into the scapula, into the middle of the lungs, and to the base of the lungs. We will only use fingertips and the middle finger, and you should avoid deep palpation. We should also determine abnormalities. If it has lesions or drainage, then we should do or wear glovings. And now, we will going to do a palpating and determining respiratory exclusion. Place your surface palmar into the base of the thorax or lower aspect of the lungs. Palmar should be adjacent to the spine and instruct the client to breathe, and your fingertips will move together and equal. So ma'am, can you please breathe? Fingertips should be moved equally and together. After that, we will go to document the findings. And now, we will be performing or we will going to assess the vocal vibration or the tactile of the client. So again, using the palmar surface to the left, we should place palmar surface to the left and right side of the posterior aspect. Ask the client to repeat words such as blue moon or 1, 2, 3. Start in the bronchial, vesicular, and to the vesicular. So this would be the loud, the moderate, and the soft vibration or sounds. So we'll start from here and to the lower part. Now, we will going note for symmetry of the vibration, and it should be louder, moderate, and soft. And now we will also going to perform a one hand to determine the parameter sound. Place the same manner in the bronchial area, bronchial vesicular, and the vesicular. Also, we will going to note for amplified sound and symmetrical vibration and any abnormalities, abnormal findings. So we'll start using one hand. We'll start from here to the bronchial vesicular and also to the vesicular. And now we will be percussing the thorax. Same principle will be applied for the posterior and the anterior. We're just going to use the fingertips and the middle fingers in this procedure. So, we will start in the apex and following the sequence. So, from the left. The same manner in the other side. After that, we will going to determine for any hyperresonance. Take note for any signs of resonance or hyperresonance and unevenness. And now we will going to determine respiratory exclusion using a ruler. Ask the client to take breath and hold her breath. Start in the cervical 7, going to the sequential pattern. Locate for the C7, which is the bony prominence. This is the reason why we need the patient to flex her neck for us to determine the location of the C7. And we will also determine the exclusion and respiratory descent. Auscultating and determining for breath sounds and adventitious sounds. We will going to use a flat disc when performing the auscultation. So, we have here a stethoscope to be used in this procedure. And we will also going to ask the client to take a slow breath. Ma'am, please do or take a slow breath, okay? So the same sequence will be going to use in this procedure using the stethoscope. Move stethoscope from one sequence to another. And after that, we will going to compare the findings from the right to the left area. Take note of the symmetry of the sounds by lateral excursions, or there is decreased diaphragmatic and excursions, and we will going to document the findings. So in this procedure, we will now going to proceed in assessing the anterior thorax of the client. So some sequence in the posterior aspect will be applied in the anterior thorax. The first thing we do is we would inspect the breathing sounds of the client, also for the movement of the clavicle, if the patient is using an accessory muscle. We should also inspect for the costal angle of the client and the anterior chest of the patient to any deviation, any abnormalities, or any abnormal findings that could be observed during the procedure. So, in palpating for the anterior chest, which is starting from the clavicle and to the opposite side here, and to the upper portion of breast bones and to the base of the thorax. So palpate from the clavicle to the other side, so in determining the respiratory excursions, same manner will be applied. We're going to place our hand to the costal angle here, and we will going to ask the client to breathe and take note of the movement of the fingernails and thumbs because it should be moved laterally. So it will be done by this. Note for unevenness or any lateral or unequal when the client would breathe. So for palpating the client, ask the client to say Blue Moon 99 or 1, 2, 3. Sequence will be from bronchial, vesicular, and vesicular. So the sequence will be the same manner. From here. If the breast of the patient or the female patient is big or displaced, we could omit this procedure. And for the percussion, we will start in the supraclavicle. Same principle is being applied. So, percussion will be done by this. Start on the supraclavicle. The same manner to the other side. So again, if the female patient has its big breast or displays, we can omit this procedure. So after the percussion, we will going to note for any resonance or hyperresonance. And for the auscultation, we will going to auscultate using the flat disc to the anterior in the anterior angle. So we have here a stethoscope to be used in this procedure. We will going to note for the alignment of the chest and to the nipple line. For the assessment of anterior, we should auscultate the PMI or your point of maximum impulse. First are the alignment of the breast and then the intercostal space. And note for the rhythm and note for the quantity of the heart sound. Perform hand hygiene after the procedure and also document the finding. So this procedure is assessing the peripheral vascular system, includes measuring the blood pressure, palpating peripheral pulses, and inspecting skin and tissues to determine perfusion to the extremities. So first, we will going to assess the peripheral vascular system, but we will ask first or inquire if the client has seen a history of the following, which is the heart disorder, varicosities, arterial disease, and hypertension, lifestyle patterns, specifically exercise pattern, activity patterns, and tolerance. Also, smoking and the use of alcohol. After inquiring the patient, we will now going to inspect the peripheral process. First, we will going to determine the pulse or the pulse of the body. So it is from here. And we will going to note for the quality of and the pulsation. We will determine for the peripheral aspect if it is a good quality of perfusion. So we will instruct the client to raise the limbs above and determine or elevated and determine for any coolness, redness, and numbness. So ma'am, I will going to raise your limb. While raising the hand of the client, we will going also to check for the capillary film. And after that, we will going to assess the peripheral leg veins for signs and phlebitis. We will going to inspect the calves for redness and swelling over vein sites. Palpate the calves for firmness or tension of the muscle, edema over the dorsum of the foot, and areas of localized warmth. Push the calves from side to side. Firmly dorsiflex the client's foot while supporting entire leg in extension or to have person stand or walk. And for the peripheral perfusions, we are going to inspect the skin and feet for color, temperature, edema, and skin changes. We will also assess the adequacy of the arterial flow if arterial insufficiency is suspected. After doing the procedure, we are going to perform hand hygiene and document findings in the client's record. So this assessment is for assessing the heart and central vessels. Assessing the heart and central vessels is one of the most complex and important aspects of physical examination. The nursing skill utilizes the palpation, inspection, and auscultation techniques for the assessment of the heart, pulmonary, coronary, and neck arteries. So, the first thing we do is to inquire the client if he has or she has any of the following: family history of incidence and age of heart disease, high cholesterol levels, high blood pressure, stroke, obesity, congenital heart disease, arterial disease, hypertension, and rheumatic fever. Also for the client's past history of rheumatic fever, heart murmur, heart attack, vasculitis, or heart failure. Present symptoms indicative of heart disease, presence of diseases that affect the heart, lifestyle habits that are risk factors for the cardiac disease. Simultaneously, inspect and palpate for the precordium for the presence of abnormal pulsation, ribs or hips. Inspect and palpate for the aortic and pulmonatic areas, observing them at an angle and to the side. Then note for the presence of or absence of pulsation. Inspect and palpate also for the tricipit area for pulsation and hips or lips. Inspect and palpate the apical area for pulsation, noting its specific location. It may be displayed laterally or lower and diameter. If displayed laterally, record the distance between the apex and the MCL in centimeters. Inspect and palpate also for the epigastric area of the base of the sternum for abnormal aortic pulsation. So we're going to palpate from here. And after that, we're going to perform auscultation. To auscultate the heart in all four anatomic sites, the aortic, pulmonic, tricuspid, and apical. So in auscultation, we're going to use a stethoscope. For the carotid arteries, we are going to palpate carotid arteries and use extreme caution. Also, we will going to auscultate the carotid arteries. So we're going to palpate it here. We will also use a stethoscope for the auscultation. For the jugular veins, inspect the jugular veins for dissension. The client is placed in a semipolar position with the head supported a small pillow. If jugular distension is present, assess the jugular venous pressure or the GVP. Locate the highest visible point of distension of the internal jugular veins and measure the vertical heights of this portion in centimeters from the sternum angle, the point at which clavicles meet. Repeat the steps above on the other side. So after doing the procedure or the assessment, we are going to perform hand hygiene to prevent us in acquiring infection or any microorganisms. And also, we will going to document the findings in the client's record.